Pratibha, you will get here 3 minutes time to be prepared for the scenario, okay? So
Yes,
here you have to talk with grandmother Mrs. Marisa about her granddaughter Sarah, who is 7 years old. Sarah developed recent onset of bedwetting for a couple of weeks. Take focused history. So you should know that this is a scenario which is very common scenario. It came previously many times. I will show you that how much time it came before and how it was. But first we will try. So you will now get 3 minutes. Okay.
Okay.
And yeah, take your time.
كيف الحال؟
عليكم السلام.
حياك الله. ربي يعطيك الصحة والعافية.
If you're ready, let me know.
Okay, ma'am.
छोटू छोटू
Okay, ma'am. Can I start?
Yes, please start.
Okay. Hello, I'm Dr. Divya, one of the child doctor working here. I believe I'm speaking to grandmother Mrs. Maria, grandmother of Sarah, 7-year-old.
Yes, Marisa. Yes, I'm Mrs. Marisa.
Okay. Thank you for coming today for the discussion. Uh, may I take some notes while discussing about the Sarah cell?
No. Hello. I could not hear you.
Hello.
Please say again, please. What you said?
Can I take some notes while discussing with you about Sarah's
Yes,
health?
sure, no problem, doctor.
Okay. May I know what are your concerns about Sarah?
So actually, I am with my granddaughter for the couple of weeks, and I see that every night she wet the bed. So I'm too much worried about it.
Okay, I'm really sorry. It must be very distressful for you, Mrs. Marisa. So can I know more about it since when it started, when you noticed it?
So actually, it was started, I think, for the last at least 2 weeks, but I'm not that much sure because I came to my daughter's house for the 3 weeks. So for the last 2 weeks, I see that every night having these issues.
Okay. So she's not. Well, I want to ask that any important event happened before 2 weeks. By any chance, do you know? Like,
No, I have no idea how and
okay.
how this happened and when, but I know that she intermittently wet the bed, like busy day that day. She suddenly slept, so it was not a regular before. But
Okay.
I said you for the couple of weeks it is too much.
Okay. Was she achieved this drive-by night anytime, like before? Do you have any idea, Miss Marissa?
So it's that I said that it's happened like usually not she not wet bed. She slept well and it's okay. But yes, sometimes intermittently it happened. I mean, when it was a bad day, exhausted and slept off early without taking, um, like toilet. And then it's happened, but it was very infrequently after 4 years.
Okay, okay. That's right. So, was she having any fever before of this? Do you have any idea?
No,
Okay. So is it every day she's passing, right? Since 2 weeks?
yes, that's right. Every day,
Yeah,
every night.
yeah. Did you show to any other doctor, or this is the first time you're coming to us?
No, I went to the GP and GP sent it to me, send it to you.
Okay. Did GP given any medicines or what is said?
No,
Any test done?
no, nothing.
Okay, that's great. How is her pee? I want to know about her pee.
Mhm.
In the daytime, is she dry by day?
Yes, right, I did.
Okay. While passing urine, did you observe any she crossed the legs or anything like that? She don't want to go to pee in the daytime.
No, I did not observe anything like this.
Okay. Uh, Like how many times she go to pee in the daytime?
It's like, I'm not, I mean, count it usually. It's normal, 4 to 5 times.
Okay. Okay. In the night,
In the
have you
night,
observed?
no, in the night, I mean, you want to mean in the sleep or,
Yeah, in the sleep.
okay. So within the sleep, never she woke up.
Okay. Okay. So what was the color of the pee?
So clear.
Clear. Okay. Any frothy you seen in the urine?
No,
Pee?
no,
Okay. How was her poo? Like, is it any hard or loose?
no problem.
It is fine. Okay.
Everything.
Uh, okay. Yeah, how's her sleep? Was he sleeping normally since 2 weeks, or she any day she got up in between?
So sleep actually, I see that
Mhm.
is, I mean, our sleep is not good and some abnormal sound coming out during the sleep time, and I mean maybe she having bad dream and crying like this.
Okay. Has she lost any weight or gain since last few months?
No, I hope
Okay.
not. And for the
Okay.
weeks
Yeah.
actually.
I want to know something about Sarah. Like after passing pee or poo, the wiping, is it front from the back or back from the front? How is it?
So usually it's, I mean, I teached her. So usually separate with the separate toilet paper, not
Okay, that's
together.
great. Who's taking care of that? Her mom or anybody else for the help?
So her mom is not actually taking care appropriately. She is always busy with the work, and I intermittently come and go. Yes, and I try
Okay,
to.
when you are not there, any help they have to take care of Sarah?
Usually, they kept some nanny or something like, for the time being.
Okay. Did I want to just ask some questions which may not related to Sarah to rule out. Any racing of heart did you ever heard?
No, never.
Okay, any breathing difficulty?
No,
Okay, any tummy pain or tummy size increased?
no, I did not notice it.
Okay. Any recurrent bug in the chest or in the tummy?
No, never.
Okay. You went to GP. Did he check any blood sugar or any blood pressure?
So never ever.
Okay, never. Okay. Any joint pain or rash?
Uh, no joint pain, but I observed she had some red rashes around the anal region.
Okay. Any om coming from there? Anything? Wall?
No, I didn't observe this in your.
Okay. 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 Any rash around the private area other than anal area?
No, mainly that area, anal area, I
Okay.
see.
Okay. So, how was her behavior? How was her activity? Is she happy or she's irritable sometimes? Anything, any specific things like that?
She's mostly remain irritable and withdrawn.
Okay, irritable. Okay. So, any previous admissions for Sarah? Do you aware of? No. Okay. Okay. Any operations?
No,
Okay.
and
May I know? Okay. May I know about her walking and talking? Is that similar to other kids of her age?
yes, normal.
Okay. Okay. May I know about the family? How many people are there in the Sarah's family?
So She's the only girl of my daughter.
Any other child?
No,
Okay. Any long-term condition in the family?
no,
Okay. May I know about Sarah's mother pregnancy? Was it normal? All jelly scans were done?
normal, Gillis Kingdom.
Okay. At birth, is it Sarah born by normal delivery or surgery?
So it was normal delivery. So good.
Okay. Okay. Did she pass a pee within for 1 or 2 days? Any problem in that time?
No, no problem.
Okay. Okay. No NICU admissions. She came to Sarah's mother without any problem that time.
No, no, no issue.
Okay. Did she taken all the jabs?
Yes,
This
completed.
is very- Okay. How's her diet? Is she picky eater? Like,
So that was, she's very good girl.
okay. Any allergies?
No,
Okay. So, if she take veggies, fruits, everything, and how many, how many glasses of water she will drink every day?
so it's actually, I did not notice it, how many glasses of water actually, but it's
Okay.
appropriate, I believe.
Okay. Uh, did you see any, anybody else playing with any older people playing with Sarah anytime? Or is it she plays with the same age group people?
Same age group.
Okay. So you told me that Sarah will be taken care by some helper in between. Was she female or male?
So usually, it's like, I'm not very much sure what happened for the couple of months, for the
Okay.
last at least 2 to 3 months. But usually it's, I mean, female, but sometimes she is taken care by her father as well.
Okay. Okay. So who's the breadwinner of the family?
Mainly, mother. Her father is
Mother.
working. Yeah.
Okay. Okay. So how has this condition affected them and you as well, like mentally?
Yeah, so it's really, I'm shocked by seeing this because I was away from my daughter, and I was returned back after 6 months, and I see what a horrible situation she looks like. She was not like this before. She was very calm and quiet now, and she's not talking with me appropriately. So I'm so much worried. But her mother is different. She is not bothering own daughter.
I really appreciate your concern about Sarah. We will help you out after the end of this discussion. So, is she going to school by any play school, anything? Sarah?
Yes, she is going to school regularly. Your
Uh,
time is up.
okay. Mm.
Okay, can you please
Okay.
summarize?
Yeah. Today I got a chance to talk to Mrs. Marisa, who's a grandmother of 7-year-old lovely Sarah. Came with the complaints of bedwetting every day since 2 weeks, and it was intermittent between like some when she become very tired or very sleepy. But she was a dry by night before after 4 years of age, and she was dry at day. There are no concerns at day, and the vaping technique also normal, and she pee and poo were normal. Her blood pressure was not checked by the GP. They shown to the GP, but they referred here without any intervention. And there was a sleep disturbance, and she was irritable and not speaking with the grandmother properly. And she also looking after grandmother came since 3 weeks, and she's looking after Sarah. But before, mother was taking care, and in between female helper, and mother was working, so she is taking help of a helper, and also she has a rash over the anal region, and her birth, antenatal and developmental history. all were normal, and it is affecting the family and also grandmother so much mentally.
Okay. So now our discussion starts. Okay. So can you please
Okay.
tell me what about your diagnosis and differential diagnosis?
Okay. My diagnosis would be secondary nocturnal enuresis. Uh, could be due to first is neglect or abuse, I feel. Then urinary tract infection and psychological
Okay.
causes.
So what can you please give a name for your differential diagnosis if it is abuse?
Okay. She has a rash over the anal region, and also she will be taken care by a female helper in between. Mother was in the work, and she is behaving differently as compared to before the grandmother seen her. And she's talking to, she's not talking appropriately to the grandmother, and she's always irritable.
Okay. So what about the family dynamics? What questions you
Uh,
like to ask?
I asked about the composition, any like who's taking care, who's the bread earner, and now how the mother take care, and the techniques of wiping, and who will be
To ask any questions?
hello.
I ask you, did you ask any questions for family dynamics?
Uh, yes, I feel the composition and who's taking care of Sarah, who's supervising. I asked.
Okay. Now you think of secondary analysis and you say neglect, abuse, TI, psychiatric. Any other medical cause can be?
But Pooh, when I asked, it is normal. They told no hard stools, but grandmother might not know. Might be constipation as well.
Okay. So what examination you want to do for the child? If you got the
Okay.
opportunity.
Okay. I would like to see previous records if present, and I would like to do a head-to-toe examination and also rashes with the permission of a grandmother and examiner. I want to look over the rash over the anal area and private area, and I would like to do the abdominal examination for any abdominal mass, like fecal mass, and um then I want to do the back, lower back and spine examination also. And I want to plot the right and weight in the age appropriate growth centiles, and I want to check the blood pressure as well.
Okay. Good. So what management you want to take for this child?
Okay. I would like to involve my consultant and behavior therapist and a dietitian and school nurse, and liaise with the school as well. And I want to do the behavior therapy first, and also social support because I'm looking after the abuse. And first, I will get the formal history properly, and I also involve the family support, and I will do the first behavior therapy, like about the how many glasses of the amount of fluid she takes and food about that, and I will
Okay. So
and educate the parents as well and grandparent.
so for the nocturnal analysis, what you want to do?
Okay. Like after involving my consultant, I want to do some blood tests like urine. I want to rule out the urine infections, urine routine, urine dipstick, and routine microscopy, and renal function test. Um and if ultrasound of the abdomen if I felt any fecal mass,
Okay.
and
Primary nocturnal analysis. understand that there is no definite cause, in that time, what would be your treatment approach?
Okay. If primary and nocturnal enuresis no definite cause, I want to educate the parents and uh, uh, parents also and about the anatomy and about time of like amount of fluids to take, intake and output, and also about the wiping technique and involve the like reward technique for the baby, not if the baby is dry by a night, we will give the rewards like stars or some books, and we should encourage the child also and parents for the like keeping the diary like a bladder diary every day to see the how many days she's dry and wet, and I want to use the alarm therapy, like keeping the alarm.
Okay, so mom is not agreed for the alarm, and grandmother also not agreed. Hello.
Okay. So I will involve the behavior therapist and education child psychiatrist.
Yeah, so you said it before. So alarm therapy is not working because parents is not agree, mother is not agree. Grandmother said that she had hypertension and having many health issues, so it's difficult for her that alarm will be on and disturbing, you know. So in that time, what?
Okay, yeah. Uh, we can use medicines, but for after the behavior, all these therapies, education therapy, we can use the
Which
medicines.
medication you can give?
Okay. I want to use oxybutynin.
Why oxybutynin?
Mm,
How the oxybutynin will work for the primary nocturnal enuresis?
okay. Mm.
Any other
I
medication?
forgot the
Like,
name of the drug. I think.
no problem. Okay,
Okay.
no problem.
Okay.
Yeah, so you did it, and discussion is complete. Time out. So, um, so first of all, make it like, what's your expectation? Did you complete your
Uh,
expectation? Are you happy?
no, I have to improve and I will improve. I tried my
Okay,
best.
that's okay. That's okay. I mean, it's now, first of all, we have to understand that how much I want to do, and you can understand so where there's
Yeah.
some lacking, you know better. So you will work on this, and you did good. I understand, and I appreciate your knowledge. You have good pediatric knowledge. I really, really amazed by your performance, and I'm really happy. And first of all, I should say that you are ready for the exam, but you have to be oriented more. You have to make it. Your shape should be more good because you have the ability, but it's just presentation, and there is something here, some tricks you have to apply, and then you will be very good, very ready. Nocturnal
Okay.
analysis came before many times, and I see you were a little bit hesitant when you heard that there is nocturnal enuresis and some important information was missing. So
Okay.
your approach should be like this: that you understand Mrs. Marisa, so you gave your introduction very nice, and then you ask and you were a little bit confused that what is this? I mean, for how many weeks, and it is new onset. So the question, if you just ask that, uh, you ask the question, but a little bit later, that is she anytime dry before, or is it newly onset? So that was the questions to be differentiated, that it is primary nocturnal enuresis or secondary. Then you should ask that is anything happened previously, and you ask these questions. That was very good. And then you ask like how many nights it happened. That was a little bit disoriented. Looks like you are not
Okay.
shaped. Okay, so next question should be like this: that how many nights it happened and how many times per night. I mean,
Okay.
is it
Okay.
one time or
Yeah.
usually when it is idiopathic nocturnal aneurysm where we do not get anything, like in that time it's happened single time. So it can be asked. And what happened? Is she awake after accident? Usually those who are deep sleeper, they not awake after accident. Okay, so that is also important question. It was mentioned in the NICE guideline. Is it small
Okay.
patch or large patch? It's also important questions for the nocturnal aneurysm because usually it is large patch. Okay.
Okay.
Then
Okay. Okay.
you will go to the related systemic inquiry, and you gave a lot of emphasis on the constipation and the how the child was taken care of to, I mean, front to back, back to front, and you ask it 3 times. If
Okay.
it is
Okay.
a UTI, then you can ask it repeatedly. But it is not UTI. No information related to the UTI, right?
Okay.
So
Yes. Yes.
you cannot ask repeatedly same questions if it is not showing up.
Okay.
Okay. So you
Okay.
have to now ask related to the bladder. No? So what is
Yes.
there? How the pooing is having any burning? You did not ask about dysuria, and is there any pain? So did you observe any color? So here you have to ask it, I mean, open type of questions. Can you please describe heartbeat? Did you observe? That should be questions, but you
Okay. Okay.
are too much. I mean, here you ask everything, started to ask all the closed questions, but initially it was open. So take care of these things. So now,
Okay. Okay.
is he having any, like, is he cannot hold the urine? That, but it's good that you ask about their holding maneuver is there or not. That you ask. Okay, so any red urine, how much urine usually she passed, and you ask how many times. Yes, that's good. And then you can ask about tummy ache, but I did not observe that you asked tummy ache. And also you have to ask about the poo habit that you ask, and I make it very clear that there is no constipation. But again, you asked repeatedly constipation related. I think it was double questions. Okay. So
Okay. Okay.
actually, I mean, don't take it too much. That I love to give all the pitfall. Okay, take it
Yes, ma'am, sure.
normally. Okay.
Because I think for me the voice was your speaking voice was very varying, so I was not completely understanding whole sentence in between. Maybe my internet issue or something. That's why
Oh, yeah,
maybe
yeah.
I
That's
repeated.
that's that's the very important pitfall. Okay.
Yeah,
Then
yeah.
then you go to the sleep. That is very important. And the child was sleep was disturbed. You understand this, and
Yes, yes.
having some sound, but you did not mention it in your summary. Okay, so it was snoring or not. You have to more clarify. Here you can more clarify. Okay, and it's important.
Okay. Mhm.
And
Mhm.
then you ask some systemic questions. That is okay. And I mean, food history you ask, and you ask about any bone pain. And but you know, it is very important. You ask only the rash. So ask about bruise marks. It is more understandable that you are looking for any non-accidental injury. Okay, so use this word.
Okay, okay.
And here,
Bruce.
you know, when I say there is some rash around the anus, in that time you have to make it more clear, like is it itchy or not. But you excluded
Okay, yeah.
worm infestation. That is very good. But itchiness and redness. So how much the redness is? Is it painful? Did you touch it? This area? Did you know about that? Is it painful? Is there any discharge from that area? I mean, anything you
Okay, okay,
to come to the point and then elaborate it, that is very important. And then
okay,
you ask about, then go to the, I mean, the antenatal, postnatal development. It's not that much important, but very important part was the family history, family dynamics. Family dynamics means what about the relationship with the father? Okay,
okay,
because it was stepfather. Okay.
okay,
So stepfather, and when I mean, why the relationship among the grandmother and daughter was not good, that have to be explored. So do you have
okay,
any
okay,
concern with the behavior of the mother? Because grandmother repeatedly want to say it, my daughter is not appropriate for taking care of my granddaughter, but you did not ask it. You was little bit hesitant to ask. Am I right?
Yeah, yes. I thought if I ask, if she think I am making her daughter here a culprit something, so I thought of not to ask, but
So
I
you
understood now. Yeah.
so you should ask it. I mean, you should ask it by that way. You can, if you think anything, she can mind, then you can say, please don't mind. I have to ask something because I want to know more appropriately, and safety issues is my concern. So it's, I mean, you got the point that child is somehow having some abuse can be. So here you have to take more deep. Okay, any
Okay.
rash for everyone, please. Any rash around the anus is suspicious, especially when the child is like this age. So it can be a
Yes.
diaper child, na? That can be diaper rash,
Yes, ma'am.
anything. But for this child, why the rash? So
Yes.
family dynamics, you have to ask very elaborately. How was the relationship with the mother? What is the father relationship? And is there any risk? Whenever you have social any concern, then ask about, is the child already knows to the social service? That should be asked. And
Okay.
many things I would say, but if you ask me, like the mother was that time only 17 years when baby delivered by normal vaginal delivery, and the divorce happened immediately after birth. Child was known to the social service. So sometimes role player is instructed not to say until they ask, and
Okay, ma'am.
sometimes they are very much, I mean, open, and they will say you everything. So here it's not important, and here, I mean, here developmental history and other things. But okay, if you ask, but these things you should not miss up. And also the school history is very important. What about the child school result? It's important.
Okay.
It's
Yes.
important. Yes, it's very important. School never miss. Family, social. UK standard is like this. It's, I mean, it's different from our home country, na? So here you have to ask it: school, social, and family. Family dynamics is their father-mother relationship, and among the family members, how many siblings? It is not very much, I mean, give you information, but you can ask it. Okay. And social history also, like how is related to the others, but could you ask about how she play and something? So child is depressed, that is also important issues. So up to this, okay. And then um, when you said about the examinations, so here I want to, okay, so first of all, differential diagnosis. Here I want to say that you will say that it can be my primarily, I think it is secondary nocturnal enuresis, but it can be what can be the causes. So it can be, you say neglect, abuse, not take it neglect first. So it can be abuse, and it can be abuse in the form of sexual abuse also can one of the possibility, but other causes I have to exclude, that is the urinary tract infection. Not say that mother is saying something for that. So it is urinary tract infection, you have to always exclude when it is recent onset. So UTI, here you can say, although there is no significant UTI history, but I have to exclude, and also other causes, for example, diabetes and chronic kidney disease, any other neurological problem. So that can be as a part of secondary nocturnal aneurysm, but I could not get any significant history. Sometimes we could not get any history, but it can be with the examination findings come out in very others way. So keep everything that you know. Here you have to, I mean, you have to say everything what you know, not stop. You have to continue. And the examinations here are very important to take the weight height that you should mention, and you will say that here you will take the inspection of the perineum and external genitalia, and you will check the lower back. You say lower back spine neurology also important, and abdomen examination also important. But here you have to go through, first of all, here you have to, I mean, examine the rash, and if any significant anything is there, and as you have concern with the non-accidental injury or abuse, so after confirmation of your diagnosis with your consultant, when consultant agree it is a safeguarding issues, you will do the body mapping, and if required, then also here you will take the help from the social service, and also you will take the senior support, and then you will do the body mapping. So I mean, you will document everything, where the rash, how many rash, and how it was, and as well as medical photography when it is appropriate. That means you know that safeguarding management how to do. And then when I ask you the management, then you say you complete your examinations, and then you will consult with your consultant, and regarding your important history, and if it is safeguarding concern is there, so if your consultant is agreed up, then you will invoke the social service and other support service, because whenever it is safeguarding issues is there, anything for for example, any child with a bronchiolitis safeguarding issues can be there. So if it is there, anything social service will be involved, and you will say you will admit the child if significant, if your consultant agreed, because safeguarding issues, you cannot discharge the child. You cannot do this, I mean, very relaxedly. Okay, so senior support is primary things, and admit the child, and also other tests you will do according to the safeguarding concern. But if there is no safeguarding concern, I will do only the urine analysis. It is the even dipstick test. So NICE guidelines say that urine analysis you can do. Okay, if it is indicated or secondary in urinalysis, if you think, even if you not think, you can do these things in a bedside test, but not the ultrasound or other things until you have significant history. But if secondary aneurysm and no cause, no significant cause is there, but it is secondary new onset aneurysm, you have to do the renal ultrasound with pre and postmortem residue. Okay, but here, here you have to know that if there is any red flag present, so you will say red flag. You will mention the name red flag. So what is the red flag? That would be the second question. If the child having recurrent urinary tract infection, continuous incontinence is there in that time, or a child having daytime incontinence, that times also review and repeat ultrasound is very important. So after then, if I ask you, it's a primary nocturnal aneurysm, how you will go for? So don't say too much in, I mean, primary things. So give the headings that you will give the behavioral management, and you will give the food management. That is the things you giving the primary heading. No? Then they can ask you to give. And also fluid restriction is very important here, and you will go first as a reward system, and ask the child to keep bladder. And here you can go for the accord, and you will talk with the parents and grandmother, as grandmother having taking care of the baby, and then I will take the approach. So it means you understand that you cannot take the decision to go for the alarm. So if you read
Okay,
up the
okay.
NICE guideline, it is nicely written that you cannot take for the in any nocturnal aneurysm, you have not that opportunity to take the decision of the alarm, because you know it is something family is involved, and most of the nocturnal aneurysms are facing bullying problem in the family. Okay, so parents could not absorb this easily, so it is difficult for them. And here you can ask them, and you will talk with the parent, and then parent will suggest you that, and you will give the here advantage and disadvantage of the alarm systems, and if then agree, then you will proceed. Otherwise you will go for the desmopressin. It is the primary drug. Never say the other medications that you said, because
Okay, yeah, I forgot I
for the, yeah, it is overactive bladder. When there is overactive bladder, then it can be oxybutynin. You can give it. Okay, so the desmopressin, how to give the desmopressin? You have idea about it? That you have to must.
No, not much idea.
So it's important, because desmopressin is sometimes they give it for the short-term basis, like they want to go for the summer camp, you know, these types of questions came before in the theory exam, right? So in that time, food restriction 1 hour before and 8 hours after. And it, I mean, so that there would not be any hyponatremia, okay? And you have to continue for the 2 weeks, it responds after 3 months, okay?
Okay.
Then you will say that I will give it, and I will observe this as a row for the 2 weeks, and then I will continue. If there is good result, then I continue for the 3 months. Okay. So it's I mean, if I say you, I mean, this is one of the question. Like if it is not improved, even with the desmopressin, that what you will do next?
With the desmopressin.
So in that time, you will say that you will refer to the child to the
Urology.
nephrologist, okay, or bladder specialist. And you said that child having some behavioral problem, and you said that I will give behavioral therapy, but mention the camps. Just mention the camps, okay? School and social service also. So that's the our discussions. Anyone having any questions for that? And it's very important exam questions. So I mean exam topics. So I'm just giving you something. So that was your so these are the questions, very important actually. It came previously only primary nocturnal aneurysms. So it came by this way also 4 years girls about daytime aneurysms in the afternoon after coming back from school. It was also came before. And you see it is only 4 years, so the approach would be different. And the secondary day and night aneurysms with non-accident injury, and it is also came like with the craniopharyngeal operation after the nocturnal aneurysms. That all of these are the, related with the aneurysms. Okay. And these are the questions you should ask diet pro that you already done. I think we covered it. And then investigations, I said you. So you see that it is from the just NICE guideline. A large volume of in the first few hours of night, and I will talk with this Dr. Farida, just a minute. So then variable, how the volume of urine that I asked you. Okay.
Yes, yes, ma'am.
So that is nicely mentioned, but why my slide is referral is very important here. Nephrology referral when that is very important questions. You should ask for this. Yeah. So, Dr. Farida said, is the sequence of management like if this does not work next to this may ruin in any books or notes? I don't understand your total line. Sentence is not very much clear, but sequence of management is like, it's not like it's not like that you have to take it is according to the age. Like a child came and having this problem, and you first go to the behavioral management, and that's all. Okay, and constipation, other management, and you can wait and then go for the child is not improved, and you will give the schedule. But when it is 7 years, parents are not dealing with this, then you have to go to the management actually. Okay, because parents when not if parents having they can be aggressive with the child if they do these things, and sometimes parents spontaneously they will say that I could not tolerate this and become angry with my child. So in that time you have to go to the management, but primary management is alarm, first alarm approach, but you can go to the desmopressin as well, okay, according to the parents wish. And these are the primary, but you cannot go to the other medication without nephrologist or bladder specialist, opinion. That is the level. I mean, in this level, we should ask by this way. So, any more questions?
No, ma'am.
Okay. Thank you very much.
Thank you so much, ma'am.
Okay.
Thank you so much.
No problem, no worries. I wish you best of luck. Okay.
Thank you, ma'am. Thank you, ma'am.
Okay, so now we have another scenario. It's Dr. Aisha, right? Dr. Aisha, are you here?
Ma'am, I'm actually a different Dr. Aisha. I'm not the one who contacted, but I'm willing to do it if it's okay.
Do you have any exam coming?
Ma'am?
You booked exam?
Yes, ma'am. It's in November.
November. Okay. Anyone who asked me before, and I said that remain in the meetings, then I will give the chance. I said anyone? I said actually, but I mean I have to give chance to her if anyone here. Okay, if no, then Dr. Aisha.
Thank you, ma'am.
So Dr. Aisha, your so it's easy, but I mean common also. Okay, so talk with Father Ahmed, about 6 years old girl Fatima with right eye swelling, which was treated with antihistamine as an allergy, but no improvement there. So, how many times you want to take? 2 minutes?
Yes, ma'am.
Ideally, it is 3 minutes, but for the saving time, I want to give you 2 minutes, okay?
Okay. Ma'am, I can't see the slide.
So Dr. Aisha, are you ready?
Yes, ma'am.
Just a minute. Sitting stand. Time. Yeah. So
Can I start?
yes, start please.
Hello, I'm Dr. Aisha. I'm one of the children specialists working in this hospital.
Yes. Hello.
Yes, thank you for coming. I believe I'm talking to Mr. Ahmed, father of 6-year-old Fatima.
Yes, doctor.
Okay, so I believe you have some concerns regarding Fatima. So I'm here to talk about that. Would it be okay if I took some notes?
Yes, doctor. No problem at all.
Yes, thank you, Mr. Ahmed. Can you tell me what are your concerns regarding Fatima?
So Fatima having swelling of the right eye.
Okay, and when have you noticed this?
So it is for the last 72 hours.
Okay, and was she okay before that?
Yes, it was okay. Everything was okay. But
Okay.
suddenly,
And the left eye is okay?
yeah, totally okay.
Okay. And uh, do you think there is eyelid swelling? Is that what you feel?
Yes, yes. I see that upper and lower both eyelid also swollen.
Okay. Do you feel that the eye is projecting out as compared to the other eye? Do you feel it's outside?
So not exactly this. It looks like this, slightly look like this.
Sorry?
Yes, it's
It,
slightly
it's okay.
looks like
Okay. And
totally out. Just looks slightly out.
okay. And does Fatima have pain while moving her eye?
Yes, complaining pain for the last 24 hours.
Okay. And how severe is the pain on a scale to 1 to 10?
So it's like 5/10.
Okay. And has it been increasing over the few hours?
It's gradually increasing. I gave paracetamol and after then it's reduced, but not complete.
Okay. And it's more painful while moving the eye, is it?
Yes, it's pain increases. Yeah.
Okay. And is there any discharge?
Yes, some discharge is there. So it's like some discharge for the last few.
Uh, okay. And what kind of discharge is it? Is it just is it like pus?
No,
Uh,
it's,
sorry,
it is whitish, watery.
watery. Okay. Uh, and is she having excessive tearing?
No,
A- any light sensitivity?
no,
Okay. And does she have fever? You,
no.
no fever. Okay. Uh, do you think there was some insect bite or anything like that?
No,
Okay. And do you think she injured herself or maybe somebody else injured her?
no.
So no bruises on any other body parts, I hope. Okay. Okay. And how is she been? Like, is she eating well?
Yes, she's eating well, no problem.
Okay. And her activity is okay? Like, is she behaving like herself?
Yes,
Okay. And what about sleep and appetite?
sleep is okay, but it's slightly discomfortable last night.
Okay. And does Fatima have any long-term illness?
No,
Okay. And okay. So, and did she have any episodes of vomiting or headache?
no, doctor, I did not get it.
Did she have any episode of any vomiting?
No, no,
Any headache?
no,
Okay. No neck pain.
no neck pain.
Okay. And you have shown it to a GP. Is that right?
Yes, yes. I first went to the GP and GP referred back hospital.
Okay. Did they investigate anything?
No, no.
Okay. Apart from antihistamine, did they give anything else?
No. First of all, when there was itching, initial day only and instant.
Okay. So does she have itching even now?
No, now no itching.
Okay. Okay. And do you feel she has increased or her weight has fluctuated? There's increased or decreased weight?
No, there is no change in weight.
Okay. And do you think the eyelid is red and red also? Is it hot to touch and red?
So it's I understand that having pain, but I didn't touch it.
Is it red? Do you think it's red?
Yes.
Okay. So I'm going to ask few questions regarding Fatima's other body parts, okay? Just to make sure she doesn't have any of these problems.
Yes. No
Does she
problem.
have, yeah. Does she have any racing of heart? Or does she say complain
No,
of racing of, okay. And does she have any tummy pain?
no.
And is her poo and pee fine?
Yeah.
Okay. Does she have any cough or breathing difficulty? Okay. Does she have any joint pain?
No,
Okay. Any pain anywhere else?
no,
Okay. And has her sugar levels been checked anytime?
no,
Okay. Any skin marks?
no, still, I did not get it.
Okay. 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 Uh, and has she ever been admitted in the past?
No,
Hello.
never. No, never.
Okay. No surgeries done or anything.
Yeah.
Yeah. And has she been growing as per other kids?
Yes, appropriate, I feel.
Yeah. Okay. So does she go to school?
Yes, she's regular.
And what grade is she in?
She is now +3.
Okay. And how are her grades? Is it okay?
Yes.
Any issues in school?
No.
She's happy. She's happy to go to school. Okay. Mr. Ahmed, can you please describe your family for me?
So she is my fourth girl, and me and my wife are living in the same area, same house, and we are happily, no problem at all.
Okay. And are all the kids okay? Are they doing well?
Yes.
Okay. And how is Fatima with the other children? Do they have any problems?
No.
Okay. Uh, when uh, when your wife was pregnant with Fatima, did was there any trouble?
No.
Were all the jelly scans done
Yes. Yes.
was she born by normal delivery or
Yes.
surgery?
She was delivered normal.
Okay. And what was her weight?
Weight was weight was appropriate at that time. I could not remember everything now.
Okay. And is her jabs up to date?
Yes.
Okay. And what about her food? Does she eat well or is she a picky eater?
She's okay with the foods. 3 times she took food, and usually it's not a problem for us.
Okay. And is she allergic to any medicines? Are you aware of anything?
No, no allergy.
Okay. And she's not on any medicines for anything, right?
Yeah.
Okay. And I believe you're not known to any social services, right?
Yes. Yes.
Okay. And just for formality sake, I have to ask this. How is the financial status at home?
So actually, we have to fight for this because both are working in a shop, so we're shift, and yes, we have some money constraint there.
Okay. Uh, okay. And how has Fatima's eye affected her and all of you at home?
So actually, we were thinking first of all it was a normal case, having some itching was there. So, but it's now increased, and we are very much worried why it has happened, and it's not now going to down. So
Mm.
that's the problem.
Okay. I understand it must be very hard. One final question. Is she having any trouble with the vision?
No.
Do you feel, is she saying it's blurry now?
So
Hello.
she did not say it having any learning issues or other.
Okay. Okay. And her hearing is okay?
Yeah.
Okay. 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 Thank you, Mr. Ahmed. I've taken down some notes. I'll discuss with my consultant and I'll get back to you.
It's now 12 minutes.
Sorry, ma'am?
It is now only 12 minutes, so maybe you get if in the exam, if you complete early, then you and the examiner will be remain in front face to face, and there will be no talk until the 15 minutes at least.
Okay. How many minutes are left, ma'am?
So it is now 11 minutes 30 seconds. Good, no problem. You complete it within the time, and it is not a big history, it's an acute history. And acute history usually is not a problem to be completed. And so let's see that how you do for the other. So start your summary.
Yes. So today I got a chance to talk to Mr. Ahmed, father of 6-year-old Fatima, who came with chief complaints of right eye swelling since 72 hours. There also appears to be some proptosis and painful movement of the eyes, which reduces with paracetamol. There is watery eye discharge. And she was shown to a GP who prescribed antihistamine, but it did not resolve with that. Mm, Apart from that, it has also been affecting her sleep, but there are no signs of any increased intracranial pressure. Mm, there is also some redness. There's no history of any fever or bruise or insect bite. Uh, she's a fourth child, and her family seems to have some financial struggles, and they seem to be worried about Fatima's eye. Apart from that, the past history, developmental history, family history, birth history, immunization history, uh, etc., are all insignificant.
Okay, so what's your diagnosis?
My first differential diagnosis would be orbital cellulitis. It could also be a case. Ma'am?
What could be the others?
It could be a case of trauma, uh, but I do not find any history suggestive of that. Uh, yeah, these two.
Okay, so can it be P-septal or P-septal? Yeah. You said orbital cellulitis. Can it be
Yeah,
P-septal?
yeah, it could be preseptal cellulitis.
Okay. So if you get this patient, what examination you want to do?
So I would like to do a head-to-toe examination first, and check for her vitals, pulse rate, BP, SpO2, and then also do a thorough eye examination and CNS examination to rule out any signs of intracranial pressure. Also look at her ears,
Okay.
yeah, and also check her anthropometry and plot her height and weight. And
So,
also oral cavity to see any.
so what you want to see for the eye?
Yeah, so I want to check the eye movements and visual acuity and
I said
also,
ER. What you want to see? You said that check the ER, right? So
yeah.
what is your expectation from the ER? How it can be related?
It could also if there is any discharge from the ear and any mastoiditis or anything.
Okay, so how you want to manage this child?
So I'd like to inform my consultant and also also involve a ophthalmologist, and I would like to send investigation that includes CBC, CRP, ESR, blood culture. Uh, yeah, and also like if there is a eye discharge, I would like to send the culture also of the discharge. And I would like to start on antibiotics after discussing with the ophthalmologist.
Any imagine you want to do?
Ma'am?
Any imagine you want
Uh,
to
Yeah, also MRI of the orbit, a CT scan or MRI of orbit, but only after consulting with ophthalmologist.
Okay. So what your expectation in the city orbit?
Ma'am?
What is your expectation? You want to give the city, right? So what's your expectation?
So there could be some inflammation or vital inflammation or any pus collection, but the child would have had high grade fever for that.
So what antibiotic you want to choose for this child? If it is orbital cellulitis.
Uh, Penicillin, if not, we can also consider ceftriaxone.
Okay.
If, yeah.
Time's up. Okay.
Okay.
So Dr. Aisha, your history taking was very, very good, but management, you missed some point. You understand this. That was very important, but you missed. And you know, when the question is easy, then the assessment will be difficult. Like a history, which is very easy history. So everyone knows about it, and consultant is usually what happens. Consultant take the exam for years, 2 years now. So they knows everything what is and they remember everything also. So read these things very meticulously so that you can answer questions appropriately in the assessment, discussion part also, so that it will be good. Because your history taking was good, but you know, it's very, very good. You have all the qualities to be passed this exam. But just I want to say something, you know, your history taking was little bit haphazard because you
Yes.
sometimes ask I complain, and then in the middle also you ask it, and at the last also again you ask it. Right?
Yes. Yes.
So if you do this, then they say they will write unstructured, just for the reason they ask you. Even if you missed racing of heart and something, they will not bother. But the structure they like. I mean, present history, past history, presenting complaints. So these are the things. If mixed up, then it is called unstructured. So here just you miss very important points. That was what happened before. So you take a lot of close questions, but I mean, you have to practice to make it broad. Okay. So can you please tell me anything happened before? First, ask these questions. Then if mom said, father said, no, there was no problem at all, then ask, is there any trauma? Is there anything like fever, ER pain, or how it is happened? Na? So usually they can have some precipitating history that need to be asked. So first of all, the open question, then go in details that I want to say. So any previous infections. So if you ask, then I can say that yes, my daughter having greenish discharge from the ER 1 week before. For that reason, she was with some paracetamol and antibiotics, but I was discontinue antibiotics because I see that discharge become reduced and I discontinue the antibiotics. So get my point, it is very important. That can be a precipitating cause. You take the history of trauma, sting bite, that is very important. And then you go to the, if you ask it, like now the presenting complaint, these are the problem, how it started, goes a little bit back, and then go to the eye problem. So what about the eye problem? Eye becomes swollen, okay? So right eye. Very good question you ask. Any problem with the left hand? No. So then how it looks like, is come out or not, and is there any redness there? So can she open the eye? What about her vision? Okay, that was very important questions that should be asked very early. But you ask, is there any difficulty of moving? Is indicate it is a orbital cellulitis, now moving it difficulty. And then every question was very appropriate: fever, any activities, how the activity, what about the behavior. So very important was air discharge, and as well as nasal discharge is also there, because after upper respiratory infection, preceptor cellulitis could be. And any facial pain, because it is written as a differentiating factors. Okay, so the pain, sometimes the redness is goes into the face as well, and the child having facial pain can be also. And you ask very important questions, that is headaches, any abnormal movement. So what about behavior, that is indicate the child having any meningitis or any other intracranial complications. And sometimes you ask like some negative way questions. There is no swelling, right? Never do this. It's not the good approach. So not ask this. Don't give some leading questions. Leading questions, they don't like the leading questions. You have to open up. If you say there is no pain, right? That means you are preoccupied and you are leading mother to say this. So it's really not accepted. So just change the way of asking questions. Okay. So it is actually short history. Then any you have to ask some more questions, that is trauma surgery related, like any eye surgery happened recently. That is one of the things. And even if you see the pediatric guideline, dental infection was also mentioned, and child having any vaccination, especially which vaccine, any jabs, any recent jab,
Ma'am?
any. So do you know about a vaccine? A vaccination can be related to the orbital cellulitis.
No, ma'am.
Haemophilus influenza. Okay, this vaccination can be, and child having recurrent infection or immunocompromised or not, that is also important. Other than, you ask very nicely. All of your history taking was amazing. I want to say, ask more open questions, but not too much open again. First open, then close questions, and don't give the leading questions, negative questions. Okay. Then your a child of this problem, if they are, then take it as a examination, take it as an emergency situation. So start with the ABC management. You will say, I will immediately assess the child in terms of airway, breathing, circulations. If the child having any airway is compromised or not, breathing, child is taking breathing appropriately, there is no shock, although child is not febrile. But you will say, because a child of orbital cellulitis, if they are, then they can be like this. So you will just here in this situation, you need not to explain too much, because there is nothing in the history. But you have to say that airway, breathing, circulation, even these questions came before in a video station, and there also you have to go to by this way. Okay. So airway, breathing, circulation, and then you will say that I will assess the child, take the immediately I will take eye examinations, and child consciousness orientation also I will check. So what I mean, you say, but just a more spontaneous and more verbal need to be. Like I will check the visions, eye movement, and I will check the child having a double visions, so color visions. I will check that it is written in the pediatric guideline. Okay, so you have to show that you are very much you are very much prompted for, you are very much rapidly asking everything, that you show that you understand that the child, it's something very important things, and management need to be early, and examination also should be done focused way. Okay. And then you will do the neurological examinations. Here examination is very important here. So that can be one of the complication of chronic otitis media. Okay, so suppurative otitis media complications could be, even it can be other like here any abscess or any other problems, it can be. So ER examination is very important. Okay, so go through the
Yes.
pediatric guideline again, very nice way. So when you said about the diagnosis, you said just it is orbital cellulitis. You should say that it can be orbital cellulitis or post-septal. Also, it can be pre-septal. But as the child is, you will give your points in favor. As the child having here, what is the problem for post-septal cellulitis? Why you are so much eager to give the post-septal cellulitis or orbital? Because it is painful movement, na? So
Yes.
child having pain and restricted eye movement. So I'm thinking it is post-septal orbital cellulitis first, and I need to admit the child and take the consultant permission, consultant involvement, especially here important is ophthalmologist and ENT specialist. Both is important here. Okay.
Okay.
So then what you will do. So you will complete the examinations and investigations. You will send, you say to complete full blood count, CRP, blood culture. Then you will check that child pass swab. You take the swab from the discharge and send for the culture. And also here very important to take the senior review and neuroimaging. You will say this because orbital cellulitis need to be take the CT scan. Okay, CT scan is involved, is very important here. So here, when it is MRI of the brain,
If there is signs of any raised intracranial pressure.
yes. So when there is a signs of intracranial, you will say these things. The problem is sometimes we know, but we do not give the all the things, and they write it that I mean, if they give you any prompting, they will take it as prompting. Okay, so after prompting you did it, but not every consultant or every examiner take it positively. They write it there, so you know already. So go through these things that I will do the consider the MRI of the brain when it is I mean, if there any features, because you have to time to time you have to continuously monitor the child. Okay, and then why you do the CT scan? Because you want to check the bone, the extraocular muscle. Is there any extension into the eyes, paranasal sinus, cavernous sinus, foreign body? If there is a bilateral swelling, in that case, cavernous sinus thrombosis is important factor after upper respiratory infection. Okay, that is one of the important differentials, but usually it is bilateral. Okay, and even foreign body organism, foreign body you can observe if anything there, like any trauma or something. Then, so what is you understand from this CT scan of the eyes? Then you go for the antibiotics name, very important. You know, here antibiotics have to be given as early as possible. If you think it is orbital cellulitis and this antibiotic is ceftriaxone and metronidazole, it is mentioned in the 52 number page of the pediatric guideline, but it is only ceftriaxone is mentioned in the orbital cellulitis part, and take it as a you have to say the 14 days. This should be also mentioned, not go only the, I mean, ceftriaxone. You will mention everything. What is the organism called for the orbital cellulitis, please?
Ma'am?
What is the organism name?
Organism can be staph, Staphylococcus aureus, or
Mm,
Streptococcus pneumoniae.
yes, very right. Staph strepto, Haemophilus influenza, now not common because of the vaccination and fungal immunocompromised. Okay, so
Yes.
if it is there, the also microbiologist also can be involved here. Remember these things.
Okay.
So if you go through the pediatric guideline, you will get that CT scan is indicated if there is orbital cellulitis. Okay, or you have to observe and you have to closely observe the child before. If there any sign, then you can go through the MRI as well. Remember these things.
Yes.
Yeah, that's the things. Oh, very important. Pain medication you have to give. Usually
Yes.
having severe pain medication. Okay, so pain medication you can give the child. Okay, if it is orbital cellulitis, but management would be different. If it is preceptal, oral antibiotic in that case only.
Yes, ma'am.
Okay, so take it positively. You did well. So just do practice by this way. Okay.
Thank you very much, ma'am. Thank you.
Only I'm just want to show you something. So this came mainly by this way. Unilateral orbital cellulitis. Even they ask these questions: if allergic to penicillin, what to give? Clindamycin, why you want to add it, and even so, jetites came. So many things can be in the history. So I have to ask everything, you know, father, mother, what they are doing. So these questions already we discussed, I think, dental problem. So guideline is enough, okay? So better you should say these things also, like I will take the ophthalmology evaluation within 1 hour. It's very important to take the opinion within 1 hour. It is very important. Okay. Patients can be complications. You see that ocular complications. They can have which are the osteomyelitis, meningitis. Yeah, and so any questions for the orbital cellulitis? Anyone having any queries? Okay, if not, there. Yeah. So thank you for your cooperation, Dr. Diba and Dr. Aisha.
Thank you, ma'am.
Yeah,
Thank you so much, ma'am.
thank you, no problem. I wish you will pass this exam and then you will come back to us again. Yeah, to give the good news.
Yes, ma'am.
Okay.
Thank you, ma'am.
Good feedback of your exam. Thank you.
Yes, thank you.
ma'am.
Everyone.